Okay, great. So welcome to the November Huddle, everyone. Firstly, I would like to acknowledge that wherever you are, you're on the land of the traditional custodians of this amazing country, and we pay respects to elders past and present. And we also acknowledge lived and living experience of suicide and those struggling today or in the past with thoughts of suicide, mental health or crisis situations, those caring for those people in that situation or experiencing the pain of bereavement. For today, I'm going to cover a few things in quick order. Someone suggested to me the other day, which I thought was a great suggestion, that I just anchor some of these things back to our strategy, which is our amazing 3-year strategy. So I'm going to touch on briefly a couple of points of an update in crisis services, a couple of really exciting projects in our local services. I'm going to talk briefly about the lived experience group in our local community efforts. I'm going to touch on our financial outcomes and our commitment to volunteers, and finally a couple of pieces of news around our workforce. So as you can see, our strategy really touches on our national services, what we do locally in our community, and then how we provide and ensure and sustain a strong organisation, which is principally about our amazing people. So firstly, to kick off with a few news items around crisis support, I just really want to continue to applaud our volunteers, our paid staff and the overnight staff, those people that do weekends and those tough shifts around our national calls and also our text and chat. So we continue to do between 10 and 11% of the nation's calls on the phone, and our text and chats have grown to over 27% of the nation's load. And every month we are growing, the team is growing the volunteer pool in the text and chat to that effect. So there's a huge amount of work, training and onboarding and doing practice shifts with new digital crisis supporters. And we now have a New South Wales-wide workforce. So there's additional work in ensuring we've got the rigour of supervision and support that our face-to-face people have on the phones as well. So I really just want to call out that ongoing commitment of everyone who is doing that crisis line. And North Sydney is beautifully operational. We've had dozens of shifts now there, and our North Sydney intake is now, our 18 students are now actually doing shifts at North Sydney. So it's very exciting to see that space. We also have a number of volunteers now doing shifts, phone shifts between Gordon and North Sydney as well. The other piece of news is we engage consistently with our peers across New South Wales who also do particularly the telephone crisis line. And recently myself and all the CEOs felt it would be very important for us to have a strong voice in the network and with Lifeline Australia around the crisis lines. And to that effect, we have promoted and are sponsoring a community of practice for crisis support between the members, and that will help us have an aligned voice on key issues back up to Lifeline Australia. And so that group has met for the first time. We have a representative in that group, and I look forward to myself and also Karen being able to give updates about what's happening across our partner centres. It's already provided a rich discussion, I believe, in that first meeting around Genesis and some of the new technology changes and how our peer members are dealing with that. So again, a nice thing for the members to do, and hopefully we'll strengthen our voice with Lifeline Australia around that core service for us. Lifeline Australia is also continuing their work around frequent help seekers, and some of that is actually starting to shift the focus where the crisis supporters can start to acknowledge to the help seeker that they have called before, which is different from the past. So yeah, so just some interesting things that are happening there, but acknowledging that the next few months are very busy, in particular for the voice team around Genesis and the big technology changes. So thank you to everyone for your patience and efforts in getting across that. This is a really exciting project that we're looking at, and I'd like to call out Judy Dalgano and also Kanie Mabry, who really were the inspiration behind this. Firstly, I'll just talk about some stats in our local area. We have large hospitals. In a Sydney context, we have 4 or 5 major hospitals. And in our northern Sydney PHN, there's public data available that would tell us that a large number of people every year are presenting to our emergency departments with either suicidal thoughts or intentional self-harm, including suicide attempts. And if you look at there, clearly there's issues around youth attempts and mental health, but you'll see that the majority were adults. And this means 10 adults a day are presenting to our local emergency departments with suicidal thoughts or intentional self-harm. And although youth has had a fantastic, although it needs to continue, downward trend in the last 4 years, unfortunately, every other age is actually going in the wrong direction with that data, which is very concerning. The other concerning piece is that evidence would suggest that half are returning home without a referral to ongoing support. And this is anecdotally what Kanie and Judy and others in this space are hearing. So the Eclipse program, which has been going for many years in our centre, is for people who have attempted suicide, and Kanie and Judy, Carolyn McGorry and other people are amazing and at working with these courageous people who have the freedom to talk about their experience and may have had a bad experience of being in a clinical setting. And so being in the Eclipse group in Lifeline really helps them steward a more positive journey coming out of those experiences. What is incredible is we now have this fantastic support from New South Wales Health to really close this gap in the emergency departments and with the hospitals to make sure these people are getting referrals into the Eclipse program or other types of services to support people who are feeling this way or have made an attempt. And New South Wales Health is recognising that the Eclipse group is a key part of closing that gap. And again, I'd like to applaud Judy and others who really have forged that connection with New South Wales Health. So what the proposal is to do a video that can be shown in emergency departments and to frontline workers promoting the Eclipse group and actually showing people from that group, helping the public and people in that terrible, distressing situation feel much more comfortable and safe to approach that type of group. So I just felt that was a really great piece of news to say that here's a great example of our local services connecting with health and really closing what we know is a clear gap in the community to save lives. The other significant piece of work we've been doing locally, again with New South Wales Health and the federal health system, is actually a tender process for our services. We currently, and sorry, I probably shouldn't have shown New South Wales Health because it's actually federal health, this one. We currently have funding for our clinical groups under Gillian's leadership and Simon's leadership. But in addition, with this funding, we've sought extra funding for Connect, for Eclipse, for Mandarin accidental counselling, and for our geo-targeting, which I've talked about before. So it was a major, major tender and a huge amount of work went into it. So congratulations to Gillian and Simon and others that worked on that, including the finance team. Interestingly, with this tender, they were seeking partnership bids where they actually want to start services being coordinated between key service providers. So we were very fortunate, and we hosted a meeting at our North Sydney office with Uniting, Mission Australia, Provida and Lifeline Northern Beaches, and a couple of other key organisations, where we actually have put in a collaborative bid to show how we ourselves are helping help seekers and local clients navigate support between us. So we're hoping to know in the next month how that tender has progressed. We'll know for certain by January, and this will commence in the next financial year. So that's been a very significant process for us, and clearly very important, because those groups we are committed to, and we definitely want those to continue. The Lived Experience Advisory Group, for those that read the update, you would have seen a great article in there from Jeanette, who, along with myself, chairs the group. It's an absolute privilege every 8 weeks or so to sit with this group of people who've either had attempts at suicide or have lost close family members to suicide. That, again, the courage, the clear-sightedness, and the value that meeting with those people creates is tangible. And we do want to, over the next few months, communicate a lot more what that group is adding to us. Their core purpose is to sharpen our gaze on how we deliver, design, and communicate what we do. And so, for example, we took call recording to them, which was being rolled out by Lifeline Australia, and they gave us fantastic feedback that we submitted to Lifeline Australia. Rachel Tem is a regular guest to the Lived Experience Advisory Group and tests some of our social media posts, particularly those ones that are calling out for people to reach out for help. Michelle Velo's been to talk through our community training. Karen and Gabby have been to talk about the crisis line. And all our other managers, financial counselling, pretty much all of them have visited this group. Connect, they were fantastic on, and they really worked hard in the initial phases of Connect about how, how people could navigate, and some of the fear that people would experience to walk physically into Connect, and how we could use navigation videos and maps, and where the room was placed in the library. So those sharp insights from the perspective of people who would actually be users really help us inform and craft those services so they can be comfortable for the people we do want to use them. So I would like to really commend people to keep an eye out for the updates on the Lived Experience group, but it has been incredibly valuable. We're also starting to think about another type of advisory group, which would be more of a youth advisory group, and how we extend Lifeline's role and reach into youth as well. So there's lots of opportunity for us to start getting feedback from our community. This is something that I think is very, very important for us to have in the back of our mind. We are not a small organisation, but from a board perspective, myself, the finance team and all the managers, we always need to be very conscious about how we're using our funds. And they're the funds that are through our grants, through fundraising, through our incredible retail and book operations. And you can see over the last 3 years, we have had substantial growth. That growth is not just through, for example, retail. It is through expansion of actual service delivery and grants as well. But overall, that is quite significant growth. Pleasingly, at the same time, we've been able to reduce our overheads. And so what that means is, for every dollar that's donated or raised or through a grant, more of that dollar is going to services. and we want to, as much as possible, make sure that our overhead is frugal and very efficient. The other big focus that we have with the board and as a management team is that we are a volunteer organisation, and that we are preserving, even during that growth, and our workforce has grown substantially as well, that we are preserving our commitment to volunteers. And so it's very pleasing to see that number with that. So I think this is an important slide. For those that came to the AGM a couple of weeks ago, Mark Hedges presented this slide as well. But I did just want to reinforce that these are sort of three key aspects that we hold ourselves to account on. This one is new. As an organisation of our scale, one that's involved in government grants, and one that does service this population through some of our services, in particular emergency relief. We feel it is time to talk to you all about having a reconciliation action plan. And so to that effect, over the next couple of months, we will be circulating this for comment. It's an initial plan. It's at the reflect stage, and we would like our workforce to comment on that plan that we're proposing to Reconciliation Australia. So today, I just wanted to say that this is coming. Some fantastic work's gone into this, and you'll see that our marketing team have actually worked with an artist to create an image just for Lifeline Harbour to Hawkesbury that is reflective of the spirit with which we would like to do the Reconciliation Action Plan. The action plan document has a number of activities which we would engage with. We already do some of these. So, for example, we do posts and media and attend events around NAIDOC Week and other things like this. But I would like to highlight this to everyone, that this is coming out, and encourage you to have a read and provide comments. For those that have had a look at our annual report, you would have also seen Lifeline Fiji mentioned. Now, I don't know how many people know this, but Harbour to Hawkesbury has had a relationship with Lifeline Fiji for over a decade, so way before me. And I think even before Wendy was CEO, if I understand correctly, I think it was the CEO before Wendy that established the relationship with Lifeline Fiji. What's fantastic is that they actually have a crisis line, and then they have local community interventions and support as well in a really difficult context. So in Fiji, suicide is still illegal, and making an attempt of suicide is illegal. So the crisis line really is a critical resource. And is run by an incredible group of volunteers. And Jerry, who you see there with Carolyn and Nicola, has come to our centre a couple of times. You'll see behind Nicola there the shield that he bought us a couple of years ago, recognising the partnership and the support that our centre plays. Now, why are you seeing here with Nicola and Caroline? And that's because the team now provides group supervision and professional development to Jerry and his team remotely. And that is so valuable to them, and they couldn't otherwise get that support. We also provide them a very nominal donation each year. A small amount of money goes a very long way in Fiji, and that helps them have security with the premises where they do the calls from. So we are expecting Jerry and Anna and a couple of his staff to come out in February to actually do a care refresher, which we're all very excited about. And the Ku-ring-gai Rotary Club is doing a fundraiser in February to help fund that trip. So very, very exciting, and I thought it'd be good just to touch on the fantastic team there. Just to finish off, you would have all received an email from Pathways Australia. Please don't delete it. It's actually your opportunity to provide your annual feedback in our experience survey. So that will be in your inbox, and we've kept the survey nice and short, and it's all anonymous, and we really, really value your feedback. This will be the 3rd year that we've run the survey, and each year your feedback really is very important. So if we look at what some of the key themes were last year, people remained strongly engaged, that sense of personal accomplishment and pride in what we do. There was good feedback that collaboration across teams had improved, and we were starting to help people feel recognised. So things like the Golden Glow Awards and other types of recognition has gone really well, and that people, as always, love their sense of team and community, whether it be in community services, retail, crisis support. There was also some really important feedback about our culture and making sure we don't become too corporate, and how we balance that, making sure also that we don't burn out volunteers, and that we really keep an eye on people becoming too stretched too thin. And we need to continue to communicate. And last year had a lot of change in it. So we did see feedback very much around some of the impacts of those changes and fatigue from that. So as I said, this feedback's really important for us, and it does help us guide how we can improve and keep going. So this survey is open for a couple more weeks, but we really would love as many people to answer that. Thank you. So that's all I was going to cover today. I'll stop sharing and open up for any questions. Thanks, everyone. Linda, you're on mute.
Yes, not surprising, Lynn. Liz, I actually have 3 questions. I'm sort of building them up on the way through your presentation. The first one was your first topic. I was interested in the frequent help seekers and that project. Could you tell us a bit more about that?
Yes, certainly. So on the phone lines, somewhat on the text line, but mainly the phone lines, Linda, and this number's not exact, sorry, but in the past, about 25% of the load are repeat callers. And some of these callers might call Lifeline dozens of times a day.
Really? Wow.
So, and there's a range of people in those, and they're called frequent help seekers. There's a range of people in that group. Some of them truly, genuinely need Lifeline, and they need. There's others in that group that might be more mischievous, and there's others that are unwell. So I think part of the challenge is where we want to be like 000, where we want people who are really, you don't want that call to be blocking someone who genuinely has an urgent crisis matter, but you also don't want to turn that call off because they might ring that day that they are in crisis. Yeah. So it's a very complex, tricky, hairy problem that I know the team have been, and Lifeline, across Lifeline, have been struggling with for many years, and there's been many different projects. Some crisis lines start to triage, in terms of is it an imminent crisis, or do you have a more specialist outbound team? And so there was a pilot last year exploring that, and if you had almost a register of people, and you can get all this off the phone lines. And there's been other work around this in terms of the queuing system with the phones and recognising what's a unique number that hasn't called before versus a repeat number. But really, it's so important through this that Lifeline Australia are talking to real crisis supporters that are speaking to these people. And we have had some people here involved in that project to make sure that's well informed.
So they identify the repeat ones through the phone number as opposed to a name.
Yeah, there's no name because it's anonymous.
That's what I thought. Yeah. Okay. Yeah. Okay. Can I continue with my other ones, or am I taking up too?
No,
any other big questions? So the lived experience groups. Yep. I was just interested to know whether it helps them as well as informing Lifeline services, because obviously you set it up as a means of getting feedback from people who are, had that lived experience. But does anybody notice at all, or is there any feedback about whether it actually helps those people as well along their journey to?
Yeah, I think Jeanette's doing some work at the moment, Linda, to put in some additional evaluations with the participants. So it's a fantastic question as always. They're anecdotal statements that I've heard from them. Firstly, from both whether they're bereaved or whether they've experienced ideation or attempts, that they are all without doubt passionate about making a difference to the system that they've been in. And the other statements you hear is the incredible role that Lifeline has played in their journey. And so part of it is also giving back to that organisation and us who have really played such a role. So there's both a strong motivation to, along with us, contribute to change. And then the next thing is that ongoing gratitude to Lifeline to do that. There's you hear very raw, real stories, and I am always in awe of the courage I'm sure. of those people. Yeah.
Yeah. Okay. Yeah. And the last one was around the Indigenous.
The Reconciliation Action Plan. Yep.
Yeah. I guess my question. I mean, I've been financial counseling now for better part of 13 years, both in West Ryde and at Lifeline.
Yeah.
And to my knowledge, I have not had any Indigenous clients. So, and that isn't because I don't want them, because it's just that they don't seem to be around. I guess my question is, what is the population in the catchment area of H2HS of Indigenous people? Because I don't think there's a very, large number.
0.3%.
That, yes, I'm not surprised that it's that small.
It's that small, but interestingly, so therefore, I'm not surprised you haven't seen one, but interestingly, the Emergency Relief Service sees a proportion way above that.
Really? Okay.
Yes. So that we have a strong representation of Indigenous people in our emergency relief.
It's interesting.
And, and that's both people who've had experience with the justice system, people on the edge or actual homelessness, and or domestic and family violence. Emergency relief is really seeing what I see as the rawest end of our community. So particularly in some of our districts in our region, Artarmon is a key one, the Ryde area and the Hornsby area, you would see those populations,
Yeah, as I say, it's interesting that we haven't, and I don't think my FC colleagues have had. I mean, maybe some of them have. We just haven't talked about it. but certainly there wouldn't be
No.
a lot. So, but it's interesting that they're accessing the emergency relief, because obviously some of our clients come from emergency relief, because
Yeah.
they will refer the ones that have the financial issues. So yeah,
that's
okay.
right.
Yeah.
Now I must say, just on financial counselling, Linda, I had one of our staff the other day say that a relative of theirs had come to financial counselling in a personally dire situation, and just received the most outstanding advice, and was just so very, very grateful. So I think it's, just the way that financial counselling, as per our other services, are contributing is just amazing. So
yeah, thank you. Well, that's
yeah.
always good to hear. And I guess the good thing about our service is that we can not only make a difference, we can make a difference very quickly.
Yeah.
To people, very often from the first meeting, just, lifting a burden from them, from maybe creditors bombarding them with phone calls and texts and all the rest of it. We can stop that instantly.
Yeah.
While we, work on longer term things. So, yeah, so that's good to hear that from a, third party. Thank you.
That's fantastic.
Mm.
Thank you, Linda. Any other questions today? No? Well, thank you very, very much. I hope that's of interest, and yeah, let's do this rundown through to Christmas, and everyone having a good break. So talk soon. Thanks.
Great.